Many doctors will agree with me that the pregnancy rate with a day 5 embryo is far better than with a day 3 embryo. But they will only do day 5 transfers when they have patients who are young with lots of eggs. So that when they have difficult patients with poor ovarian reserve with maybe 1, 2, 3, or 4 eggs, they will transfer this back on day 3 and they will not grow these embryos to day 5 because they're scared. They're scared that if they grow them to day 5 and it arrests in the lab, which means this embryo stops growing. Let's say it stops growing on day 3, it's got 6 cells and then it doesn't develop any further. And they will not have any embryos to transfer, and the patient will get angry and upset and say, hey, my cycle failed because you did not provide me with the right medical care. Whereas on the other hand, if they transfer a day 3 embryo, even if it's a poor quality embryo, even if it's fragmented, even if it's got 4 cells or 6 cells, and they put it back, they can easily fool the patient and say, see, I made an embryo, I put it back, it didn't implant, there's a problem with your uterus, or there's a problem with this, that, and the other, or maybe you need surrogacy, or maybe you need PRP, and they take these patients for a ride. In our clinic, we will always grow embryos to day 5, even if the patient has only 1 egg. Because even if the embryo arrests in the lab, it's valuable information for the patient because at least they know why there is a problem with their getting pregnant. Remember, an IVF cycle is not just a treatment cycle. It's diagnostic, it's prognostic. It gives us such valuable information for future cycles in case this cycle fails. And if the embryo arrests, we can tell the patient, look, there was a problem with the embryo. There was no point in wasting your money and having that horrible 2-week waiting period where you're not sure whether you're going to get pregnant or not. And then if you fail, you're not sure why you failed. This way, at least we clearly know what the reason for you not getting pregnant is. And then we can adapt accordingly. Perhaps we can try a new superovulation protocol. Perhaps you can consider donor eggs. The important thing is to be transparent with patients, make sure they're well informed, document the embryos for them. And because we have so much confidence in our IVF lab, because our embryologist, Dr. Sai, is so good at taking care of embryos, we know for sure that if that embryo is going to grow and become a day 5 embryo in the human body, it will become a day 5 embryo in our incubator. And if that embryo is going to arrest inside the human body, it's far better that we know that it's arrested in the lab because we can see it with our own eyes and then provide patients with this invaluable information so they can make better decisions for their next cycle.